The day man started staring at screens and rather than the stars on the sky, he had inadvertently lit the fuse for the ticking time bomb of addiction. The next topic will be social media and screen addiction, a panel discussion. The faculty is Dr. Nandita Chattopadhyay and the panelists are Dr. Mohammed Ismail, Dr. Aram Chenthil and Dr. Ravi. The panelists and the faculty can please occupy the dais.
Just before lunch, we are going to take up a topic. Thankfully, not much of academics into it. It is very much a social topic with, of course, a medical background behind it. So, social media and screen addiction. Now, next slide, please. Do I have a... I'll just quickly go through these. We have eminent pediatricians with us as our panelists, Dr. M. Ismail, Dr. Chenthil, and Dr. Ravi Chellaih. I am quickly going through this. You know these eminent pediatricians. And now coming to the topic, I'll give a disclaimer. Yes, we are concerned about the screen, but why? Well, if we go back 40 years ago, all the screen we knew about was a TV which belonged only maybe one in a neighborhood and for 3 hours a day. And people from around the neighborhood would come to see a program. This was the only screen we had. And over the last 30, 40 years, it has evolved into all this, and all with some importance. Can we say that it is useless? No. We need screens for education, we need screens for information, for communication, entertainment, everything. So the conclusion is, screens have today become an essential part of our life. Look around this hall. How many of you have the screen in front of you? I mean your mobile phone. I can see many of you. So that's what it is. Its role in today's society cannot be ignored, and screens have come here to stay. Under this background, again, look at today's child in this world. This child has been born into a world of gadgets. And there is internet, there is social media, so their getting involved in the virtual world is but natural. Are we going to condemn it totally? No, but still there are issues. So we will now quickly go through these issues with our esteemed panelists. Social media, screen addiction, why so much concern? These are our panelists, we've already introduced. I have kept this slide only to show these two pictures, which has a great meaning. These come from the hospital wards of Dr. Ravi, and this is the true picture in any of our wards. This is what our kids are doing. Okay, so I start with Dr. Ravi. If I've got I hope I don't have the name wrong. Thank you. So I will like to ask you, what are the ill effects of screen? Why are we scared? If we come to concentrating on infants and young children, what is the problem?
Good afternoon, one and all. I think it's the lunchtime and we can see many people just going out for lunch. Anyway, we'll make the time within the fixed 40 minutes. So as Madam was told, what are the ill effects of screen time in infants and toddlers? So the first thing is, when they have the screen time in front of them, as you said, that photos I just took it from my resident took 2 days ago in my ward. So in fact I was doing my rounds in the ward, and these two children were having IV lines in their hands, and they were never bothered. Like I was doing a resident room with 15 to 20 residents around me. So the ill effect is there is no eye-to-eye contact with the persons and no communication. They are just addicted to screen. And when the mother pulled that mobile phone away from that child, and immediately the child started screaming. So this is the first ill effect is they want to be away from the world, and their world is only within their hand, palm of the hand. So in the long run, when we say The ill effects of screen time is there won't be any communication, there will not be any one-to-one contact or eye or anything, and they'll be living in their own world. Like somebody has told, some zombies were there. I think sometime back it was seen in USA, and so everybody sits in one corner and does something or so on.
Yes.
So that's what we'll be
No communication
expecting.
at all.
Yeah.
So imagination goes away. Two-way communication doesn't develop.
Yeah.
So there is no two-way communication actually. So the child doesn't learn to communicate, doesn't learn to motivate others. In imagination, all these are suffering. Now, we go on further. This was a young child. The child is now growing a little bit. Coming to Dr. Ismail, what happens in school-going children? How is the screen affecting
thank
them?
you. Thank the organizers for giving us the opportunity and thank our moderator. Of course, actually, every school as a child, the mother is having a problem. See, getting ready for the school and the bus is coming at right time, the child is not getting ready. Why? Because the child has been with the gadgets or with the screen for a longer time in the nights or in the play. It goes for an excessive sleepiness. Not only that, because that pressure, when it is applied on a child, regularly she behaves in a different mode. He is not behaving naturally because he becomes through tantrums or he becomes wild or shouts anger with the mother. This, because of the sleep disturbance, there will be a behavioral problems as well. Not only that, the attention span is lost. Whenever you see a child is more focused on the screen, the attention span is lost and they get low grade in the schools. See, for us, when we were young, we were used to read this Ambali Mama, Chanda Mama. That Irumbukai Mayavi, there was a one small comic novel will be there in Tamil, which gave lot of imaginations, what that Irumbukai Mayavi will do, what this Chanda Mama will do. Everything was there because we used to read books. But nowadays, the habit of reading new books is gone. So what happened? They don't develop the social skills, newer technology. And so the second thing is because the children are more hooked to screen, they don't go out and play.
Absolutely.
See, there are, when kids were, see, when the children were given like a building blocks or something, a picture was torn into different pieces and asked them to assemble. They really had that creativity, thoughts, and their newer imaginations were there. But now everything is gone. So the child is sitting, develops obesity as well. So their ill effects goes on. There are behavioral changes, sleep disturbances. They don't make new friends. They don't read books, and obviously they score less in academics.
Thank you, Dr. Ismail. And you have pointed out two very important insights which we often don't think about. Why is reading more important than the screen? In the screen, it's something happening very fast. The child is looking at it and it's just changing. The child does not have the time he needs to process the thought. Whereas in a book, he has his own time, in his own way, he is reading, he is imagining, he is thinking. This is a promotion that doesn't happen. Another thing you mentioned about blocks, it is very, very important. The child may see in an interactive TV program how to build something with blocks. But remember, that is two-dimensional. But life is three-dimensional, which we will not get unless the child feels the block. That tactile sensation is there. Okay, so we go on with this. Now coming to adolescence, a very difficult area. Dr. Chenthil, what are the problems there?
Yeah, அனைவருக்கும் இனிய மதிய வணக்கம். Yeah, in adolescence, they themselves are really confused about themselves. They confront the family, and they have so much of pressures, academic pressures, peer pressures, and all those things. So they definitely have all types of moody problems, mood swings, and definitely it is going to hinder them actually. And definitely because of the increased screen time, they go to models and actors and they think that my image is not okay. So they assess themselves and they feel they are too thin or too obese. So that is how it affects them by poor role modeling. And definitely they don't have enough time for sports or any other cultural activities or any other with the spending time with the family or friends or anything. then they tend to take risk-taking behaviors, like they go for the selfie culture and taking selfies in dangerous locations, dangerous driving, seeing all those video games and all those movies. And all sorts of violence are given in the screen. So they go to it, go towards it, and that is being embedded in the brain. We know that the brain is maturing right from in utero till adolescence. We know that. We'll deal it later also. And they go into the smoking, alcohol, drugs, and all this unprotected sexual activity. And it definitely affects the sleep also in them. They tend to be awake till 1 o'clock, 3 o'clock, then sleep late, and definitely they lose their focus. So it is all interconnected. Substance abuse, the sexual behavior, mental health, physical health, definitely there is a cognitive impairment.
These are issues which are coming up in adolescence, and screen time is promoting all of these problems. Okay, if that is the scenario, there are ill effects. Screen time affects brain development. We must be aware about this. But how does that happen? Here comes in the medical knowledge that we have to utilize, the insight that we have to utilize. I go to Dr. Ravi. How does it affect the early years? Brain development occurs in the early years, we know. How is screen affecting it?
As we all know, and everyone agrees. See, the brain myelination itself, it depends on multi-factors. See, when we were young and even now, everybody tells, even when the baby is inside the womb of the mother, they tell, have positive thinking, talk positive, the mother should talk positively, and then the person who sits across the mother, who is talking to the mother, talks positively. So life starts from the womb and myelination starts from the beginning. So the brain keeps growing, and brain has a positive effect. There is a stimulation goes on. When we have a screen and when it's something abnormal, the brain takes a backstage. So the myelination, everything has a stop. Ill effects are there, stops, heralds, and then all other things happen. When there is a positive and a negative, the negative forces go inside. So the positive effects go. So this exactly as what you mentioned, attention span is reduced. Empathy, they are not unable to control the impulses. Exactly, very good word. Because as Professor Chenthil sir was telling, and Professor Ismail sir was telling, they are unable to control themselves. The screen controls them.
Absolutely.
So they go to a stage where they take selfies, they do some unwanted things unknowingly, because the screen, in this era of artificial intelligence, I don't know how far it is going to help our medical field, whether it is a positive or negative or robo or something. We are pretty scared. We are taking with a pinch of salt. So we don't know whether we are going to be ruled by them. So same, because slowly the screen takes over the job.
Absolutely.
So that's what happens exactly now.
So early development, and we're talking so much about early childhood development, and this screen, and this first line, screens hijack attention span. This I have taken verbatim from UNICEF. That is what they're saying. Actually, it's hijacking away the early childhood development. From here we go on to, again, Dr. Ismail, how? Yes, we understand. In a little older children, how is it affecting older children, apart from this learning and development part?
I think we can look at the four perspectives actually: physical health changes and psychosocial, psychological, social and neurological. Actually, what happens in the physical health is they are more actually sitting is now becoming more than a smoking. It has been said. Okay, the child, most of the time it has become sedentary life because he lies on the bed, in the couch, eating some chips or fried items, unnecessary items, not only accumulates fat, but what happens, lifestyle modification diseases like non-communicable diseases, it becomes a pro rata for that. But actually, they develop high blood pressure later on life. Their cholesterol, especially because of poor inactivity, they have a very low HDL cholesterol. And of course, they develop insulin resistance as well. And of course, the vision part of it, if you look at it, there is a terminology called asthenopia. There is a lazy eye or a computer eye syndrome. Because of the dryness, because they don't blink. For a normal vision, everybody should have a layer of a tear. But if it has not been blinking there, the eye becomes much more dry and the child goes in for a early impairment. Even the retina gets damaged. So we need to be very careful. Not only that, the bone part of it, because poor nutrition, they don't take much of a protein, they lie down, they're not exposed to the sun, so vitamin D deficiency, so everything affects the bone as well. So come to the psychological part of it, actually they have, because of that addiction to the same screen, as Madam rightly said, it is not a communicative one. It is only thing one way. They just look at it, they be more hooked, and then of course they become stressed out of it, and lack of sleep. All that makes into a sort of an anxiety, anger, everything comes, and followed by a depression. And this depression, of course, even in the last year, one of the famous music directors' daughter she's committed a suicide. Because the aloneness, because she missed a father. So there was no communication, and the child felt alone, hooking onto the screen all the time, finally took a decision to die. So it is actually, what happens is the suicidal tendencies, they become more. So I think ADHD again. See, ADHD, the factors related is three things. One is the attention span. Second thing is hypersensitivity. Third is an impulsivity. So these three things, when they creep into a child and the child goes for an ADHD, definitely it will be a spoiled child. So these are all the changes in the school going age group.
Thank you so much. I go on to Dr. Chenthil with a question. Does it affect the brain? All this we've talked about, is it just our imagination? Or is something happening to the brain structure really? Is it affecting the brain structure and the function?
Yeah, we all know that. I told you previously also, the brain is developing from in utero. It goes up to mid-adolescence, till 25 years. The cognitive control network of the brain in the adolescent, it goes up to 23 to 25 years. The functional MRIs are showing it clearly nowadays. So we see that the prefrontal cortex is developing, it is completely developing only by 23. So in the early years, if the screen is being, more time is taken, definitely there is a damage in the frontal lobe. So this is what is happening shown by these studies. You can see the Chinese study and of course the John Hutton study. So these two studies are telling that definitely there is going to be language development is impaired. There is a reading skills and social skills like empathy and understanding are all impaired. The expressions, that part of it is also having a problems. So at all ages, the damage is being done because of this screen, and the brain structure and function is altered and they are wired differently. And we see that the accelerated maturation is there in the visual processing area. But definitely because they are constantly seeing that area is developed. That is the part actually, whichever you stimulate, that the wiring happens. If you understimulate, there is going to be definitely problems, and see that there is these higher order areas that support the complex skills. That doesn't happen, and it leads to all types of autism, ADHD and all sorts of problems. We are seeing together all these days because in earlier days when we were studying Nelson, we studied autism as one paragraph as a short notes. But now we are seeing autism, there's a conference on it. So.
And just like the visual area is showing a lot of overactivity, less activity is seen in the limbic system, in the hypothalamus, which again we also see in autism. And the studies that are being performed are characteristically looking at the cortical thickness and also the sulcal depth, which is definitely impaired. Okay, with all this, now the house is on the platform that yes, it is dangerous. If so, and we are not supposed to stop it, then there must be a bar somewhere. So what is the limit? Where do we need to hold ourselves? Screen time and children, how much is too much? Let's see. So we go on to recommendations for screen time. Now, the global bodies and also the national body like IAP, AAP and WHO have laid down definite guidelines. I will request Dr. Ravi to please highlight on the guidelines.
Yeah, this is exactly what I think all over the world people put their head and check the brains and they have found out as what we have seen in WHO and AAP, American Pediatrics. This is exactly what they're telling because everywhere when we had the working pattern became work from home and during COVID time everybody was sitting inside. They did not have any outlet or anything. So this again had multiple effects. So I think they have come with a very good recommendation saying no screen time for babies under 2 years and up to only 1 hour per day for 2 to 4 years. I still remember because I mean 1 year ago when the COVID time came down, the virulence of the COVID came time and slowly we started our clinics to function. One child came inside and I was just roughly telling this AAP recommendation. I was just reading one journal. So the child was only 4 years. The child just asked me, well, uncle, you're telling only 1 hour per day, but my class teacher is giving class 4 hours per day.
But
And
then they've
tell me,
clarified
so I was,
1 hour of recreational use.
so I mean, I couldn't answer that question for a couple of minutes. It really took me. So exactly so this is what exactly the recommendations. This is not during COVID time, general time, as Madam told, it's for entertainment, other purpose, not for academic purpose. It's less than 1.5 years, we generally tell avoid the screens for your visual thing to get better, and 18 to 24 months have somebody watching with you and minimal viewing, and 2 to 5 years have only one screen, 1 hour screen time, and 6 years and above we have other, of course we have all IIT, JEE and all needs starting from the age of 4 years. I think slowly, I think they'll move away from this into the other coaching centers, all centers flourishing everywhere all over India. So this is what exactly they mean. Ideally, I think exactly to be, if I am correct with all these, I think experts will all agree. Less than 1 hour for anybody, I think, any child for less than 1 hour will be the ideal thing for them because they have other activities, their social activities and then other physical activities, their physic building will be better. So that was, we think, I think, general, less than 1 hour a day for everybody, including us. Only we parents cut down our screen time for less than 1 hour, we can expect the children to cut down by less than 1 hour.
Very important. This one, I know it is not very well readable, but this is the IAP recommendation, which varies a little from the AAP one, and it's very clear cut. As sir has mentioned, up to 2 years, it is 1 hour. 2 years to 6 years, it is 2 hours. Clear cut. Whereas AAP does not mention that 2 hour thing. They say make it consistent and so on and so forth. Maybe because of their litigation in the Western world. But maybe it's best we stick to this. And again, this 1 hour, 2 hour is the recreational use beyond the school hours. With this, I come to Dr. Ismail. So what are your tips for parents? When we tell parents, reduce the screen time,
True, madam,
they'll say how?
Yes, Dr. Ravi was telling us, actually a kid was asking him that how can it be when the class itself is going for 4 hours, how can you say it to me for an hour? But it was an interesting thing happened in my life, actually, in my practice. My sister-in-law called me during the corona time. She's the mother of 3 kids, actually, different age groups, 16 years, 11 years, and 4 years. She find it literally crying. I can't manage. I don't know. They are not coming for eating. They are not sleeping. They are always in the hook to the screen. I don't know what to do. You are a good pediatrician, but you are not giving us anything. You just tell me, don't use the screen for more than 1 hour. How can I communicate? You just give me some tips. So that is what we need. See, we need, as a pediatrician, there is no point in telling the IAP recommendation or AAP recommendation or so many AAP coming recommendations. That never works out. See, there should be practical things. What are the practical things we need to talk to the parents? That is the important thing. See, whenever you want to see in the school going age group, a parent should have a better leverage with the children. They have to communicate properly and they have to put their hands on their shoulder, hugging the kids, and then watch the screen together. Then tell them what is good. Even in the advertisements, nowadays a funny thing, even my son when he was young, seeing advertisement for the diaper, he was asking me, what is this? I was not in a position to answer, though a doctor. I was a bit feeling embarrassed for that. But I think when you sit with the kid and then explain about the advertisement, which is good and which is bad and what to take it up from that advertisement, and that creative thing, making him think in a vulnerable way, in a good way, I think it is always matters. So the good tip is you have to spend quality time. You need to sit with them, watch whatever the screen is there, whether it is an internet, Instagram, or it is actually TikTok or whatever it is. You need to sit with them and help them what to watch. And not only that, you should have this thing. You should remove all the gadgets before their sleep. When they are going to bed, 30 to 60 minutes before the sleep time, when the induction of the sleep time, they should be away from the gadgets. It should be a rule framed at the home. That is more important. And all the more, the madam has put it in the red, because you are the mirror for your kids. Kids never obey you, kids never listen you, but kids will observe you, watch you, follow you. So I think they are better observers. So I think if you do it properly, if you limit your screen time, automatically your kid will also follow that. The next is, there should be a family rule. You should have a setting in your family. See, consistently, you have to plan, you have to involve your child. It has to be individualized for each child. Not only that, you have to take their whims and fancies in preparing the chart and see, make sure the set of rules which you frame should be followed by the kids. What you design, it should work. See, the consequences, what is going to happen, it is a pre-decided one. So what you need to do is, you have to follow you should give a set of rules. See, even in the kindergarten, Montessori, it has been taught, don't do. When the child wants to go for the urine also, they say no, at interval, please stop. When the child wants to communicate in a kindergarten, teachers say finger on the lips. We always talk negative things. We say don't do is being taught much than what to do. So I think there should be a clear-cut guidelines, a set of rules should be formed, and that rule should be specifically followed by others, and if it is being followed properly, and the kid should be rewarded. That is the thing you should do.
Absolutely, and the rules should be for the family.
Yes.
The family rules. And again, we should harp on this issue, that it is not only the time factor, it is the quality of the program that is being watched, number one. Number two, pre-viewing. Know what your child is watching, watch with your child. These are, I think, the three major things. That is more important.
I think nowadays, most of the contents, even for the movies which come out, it is extremely violent. They either use a sniper and kill all those people, or take a sickle and they chop the head. That it has been shown. And a kid watches it is very pathetic. I think we need to be violent content, though they are taking it, we need to see to that the kids are not viewing that.
And from these children, we go on to adolescence. Again, a very difficult time. So I hand it over to none other than Dr. Chenthil, who has been working with adolescents. What do you have to say about their screen usage?
Next slide. So the adolescent screen, we have to, this age, they are really, you must tell them, you focus on academics, because they have the online classes, they have their gadgets that are helpful for them. So for academics and creativity, definitely you can use it. Though there is a overwhelming use of gadgets, don't overdo anything, but for definitely restrict for socializing, like all these Instagram, Facebook and all those things, social media, and for gaming, definitely avoid, because you are going to have your academics first. So the priorities are there. So definitely you must inculcate the cyber etiquette to the adolescent, and safety. These two are very, very important areas, because predators are there, bullies are there. So you have to teach them, and you have to tell them. If you don't tell them, definitely they are going to land up in problems. So that is where prevention is more important. And of the rule of 20-20-20, I think everyone should know that, everyone will know that every 20 minutes, look at an object about 20 feet away and just focus there for 20 seconds. So, or close your eyes. And definitely go for frequent blinking. So the pyramid also exactly shows that ultimately, which is the priority, the pyramid shows that. Next slide. So the screen over usage, definitely the adolescents, when they use it more, their time is consumed totally. They are hijacked, really. They are also hijacked. So the focus is diverted. They can't focus on their academics or art or recreation, whatever they are good at, even at sports. Nowadays, even in sports, I mean, during the sports activities also, people are with the gadgets, with the screen. And even in clubs, even in grounds also, they are with the mobiles. So these things have to be avoided. Definitely, after COVID, and of course, because of the sedentary thing, overweight and obesity has been on the rise. Definitely, it is going to be a problem, and 20 to 25% are becoming obese. This is a problem pediatricians have to tackle, whether you like it or not. So and definitely, what happens is the adolescent viewing all those things. நட்டவுடன் ரோஜா பூ இன்றைக்கே பூக்கணும். The unrealistic expectations from them. இன்னைக்கே நடக்கணும் எல்லாம். இன்னைக்கே everything should happen before me. So this is how their expectations become unrealistic. Then definitely their learning and memory problems arise. Sleep disturbances which precipitate the mental health problems. The no screen places are always there, but we have to follow it.
So, with this background, now we take up another word, that is screen addiction. I know we are running out of time, so we will go quickly. But what is screen addiction? So, to go into that, what is addiction actually? It is an inability to control use of a substance or behavior despite negative consequences. We know there are negative consequences, but we cannot help doing it. This is addiction. Now, if a person engages in screen time or video, ignoring other normal activities, that is when we can define it as a screen addiction. And if so, screen addiction is a disorder characterized by excessive and compulsive use. What is most important here is that smartphone addiction is now a recognized health problem. So, let us look at screen time and social media from the addiction point of view. What happens? We say that screen addiction is more in teenagers. To come to this issue, let us try to understand why this addiction happens. Like in any other addiction, it's a pleasurable feeling, and pleasurable feeling leads to production of more dopamine, which gives a feel-good phenomenon happens. As a result, the individual indulges in that activity for more dopamine, and it becomes a vicious cycle. Now, this happens in all of us. But why teenagers? Because teenagers have a heightened this reward sensitivity. They are looking for rewards, whereas the negative inhibitory control from the prefrontal cortex is not yet well defined. So, at this stage, they are more prone to go into addiction. With this background, I would again go back to Dr. Ravi. How would you identify screen addiction? What are the signs and symptoms of the addiction part?
So, if you all remember, I showed that photo of a child sitting in my ward, patient getting IV drugs, antibiotics, and watching now. That tells the whole world about what is screen addiction. So exactly what happens, as you told the definition, they feel that is the only gadget in the world, and nothing is apart from that world.
And if you see an adolescent who is very much hooked to his screen, when would you call it an addiction? What other features in the adolescent would make you think that this child is addicted?
So as Dr. Ismail told, in every household we have adolescents. You call them, they won't come. You call them 10 times, 15 times. You ask them to come for lunch. You ask them for food, they will not come to you. You ask them to just go and open the door, they won't do it. You ask them to get a water, they won't go. The moment how to control them, just disconnect the Wi-Fi, they will see you. So I think that's the best way what we do, so that they get addicted. So only thing, when there is an interruption in the thing what they are seeing, that what exactly, then they come to the life. So that is what we have seen, the addiction, screen addiction. They are unable to control themselves.
So
the gadget controls them.
Total lack in their own self-image,
and
taking
others.
care of themselves, taking care of others. Everything is lost against the screen. As a result, there is disconnecting from all relationships, friends, teachers, family, avoiding responsibilities. They don't want to take anything on themselves.
You disconnect the whole family, you disconnect them away from, go inside a room, keep them locked inside, and then forget the world.
Absolutely.
Forget the world, food, they disconnect with them also, they disconnect.
So, Dr. Ismail, why are teens we have talked about the pathological part, but what are the social circumstances which lead adolescents towards this addiction?
See, most of the time, the teenagers are not being appreciated by their own parents. Where they get their appreciation and rewarding is there from friends. So, whenever, not even nowadays, the friends, they don't talk and they don't meet. Because
Virtual
if she
friends.
dresses up nicely and puts a post in the Instagram, she gets about 1,000 likes. And the rating is valued on the how much likes she gets it. So automatically she finds affirmation from the friends, and she thinks they are the people who can guide her in their dressing part, or how to talk, how to socialize. Everything is, they are far better than the family. So that is why the teenagers are becoming more addicted to this. They get the impression that this is much better than what we've been taught by the parents or the teachers or the school. Not only that, actually, they have a sense of gratification. Actually, that is because what happens is the mesolimbic system, which they have, it has been actually the dopaminergic. Actually, when this mesolimbic system is actually been stimulated by seeing the screen, actually they have the dopamine is secreted more, and that gives a feel of highness. So that makes them very much attached to the screen. Not only that, the generation which is born after 1997, they are all called that Generation Z. These people, they think because they have born when the gadgets were all around. Because yesteryears, we didn't have gadgets, we didn't have mobiles. When we were young, we didn't have all those things. But now our generation, this Z generation have everything because of the social media is the key. So they have more addiction tendency. And actually, this addiction can lead them to the pattern of sleep is altered. Not only that, they go and prone for more anxiety and depression. And of course, they are poor in their academics. And it is the gateway for the substance abuse. So once the substance abuse is established, the antisocial behavior automatically creeps in.
So how would you handle this, Dr. Chenthil?
Yeah, we have to limit their screen time and talk to them. If you have to set some limits, that only for recreational use, only 2 hours. And of course, you have to lead by example, and you have to be assertive. If you are not assertive, definitely it is going to be a problem. But there is no point in arguing or hitting them or doing any punishment. That's what the family rules also comes. So remove the devices from the bedroom, no screen time during meals or before bed. These rules have to be implemented strictly, and only then this will discipline them. So sometimes what you can do is challenge your family to go 1 week without watching TV or without gadgets. So that will give them what is without gadgets, how the world will be. That is a peep into that type of things. So you find things to do with your, go for a sports, go for a vacation, and there comes the green space, like take them out. Go for a picnic or something. Go feel with nature. Go for a cycling, go for a walking, see the butterflies and all those things. This will help them. Definitely, we have to be role models.
Thank you very much. And as time is short, we will quickly go into another very important paradigm, that is autism. Whatever problem the screen attachment is creating is very akin to what we see in autism. So the two together have a symbiotic effect. Let us see what happens. Why is it so important? Dr. Ravi, how does it affect communication and social skills? Will we quickly go through these?
As we all know that autism itself, the main is that there's no communication, and screen time becomes, it's like pouring oil in the fire.
Absolutely.
So the therapy, everything is lost. Whatever you are going to do, possibly everything is lost. Very simple logic. When you call autism spectrum disorder as a lack of communication, that is a biomarker. And when screen time takes away the biomarker, I think the whole thing is lost. Your precious time is lost, the stimulation time is lost, and time loss is lost eternally. So that is, I think the best way is to just keep the children away, stimulation in a better way, not by the screen.
So how is it affecting the emotions in an autistic child? Autism is related with lot of emotional issues.
Generally, actually, the autistic children, they tend to have this emotional dysregulations. Actually, because of that, they become easily arousable children, actually. That is why, actually, they have exaggerated stress responses. So, the screen time always increases the stress responses, actually. And of course, the children are more prone to anxiety, including OCD. So the screen time tend to increase the OCD. So I don't want to go into the details.
In short, all the emotional factors that autism has is aggravated. Thank you.
Yes.
So I will quickly go on to the last topic of great importance, that is virtual autism. Dr. Chenthil.
Yeah, this is one thing we have been noticing in our practice. I mean, we are seeing so many kids who have glued, they've been with the mobiles right from 6 months of age or 1 year. And this is where this virtual autism coined by Marius Zamfir, a Romanian psychologist, this is one thing we see practically. I mean, though their language development is not okay, but still having glued to the screens, they imbibe what is in the screen and they repeat it and they start blabbering what is seen in the screen. And you see that they stop responding to the names and speaking words, they avoid eye contact, and this virtual autism is definitely seen here. It requires a lot of studies in India. There are so many studies from other countries, but we need studies from India. And this pattern is seen because here what happens is...
Can you go to the next slide, please?
What happens here is, நம்ம ஊர்ல இங்கிலீஷ்ல பேசினாதான் நல்லதுன்னு ஒரு வயசுலயே பழக்கப்படுத்துறாங்க வீட்டில். இப்பவே இங்கிலீஷ் பேசு. All the parents are becoming teachers before 3 years. வீட்லயே நீ இங்கிலீஷ் பேசி பழகு, எல்லாமே இங்கிலீஷ்லயே பேசி பழகு, தமிழே வேண்டாம். இப்படி பேசி பேசி என்ன ஆயிடுது, கடைசியில் ஒன்றுமே இது தமிழும் புரிய மாட்டேங்குது, இங்கிலீஷ் அங்கே மொபைலில் வேற அது எல்லா ஸ்க்ரீன்லேயும் வந்து இதே தான் பேசிகிட்டு இருக்கு. அங்கே இங்கிலீஷில் பார்க்குறாங்க, கொரியன் பார்க்குறாங்க, எல்லாமே பார்க்குறாங்க. ஸோ தேர் இஸ் அ கன்ஃபியூஷன் அண்ட் வாட் ஹேப்பன்ஸ் இஸ் the brain is hijacked totally and our people, நம்ம ஆளுங்க வந்து தமிழை வந்து கண்டிப்பாக தேவையில்லை, ஏன்னா அது வந்து தேவையில்லாதுன்னு ஒதுக்கியாச்சு. You must learn one at a time, one step at a time. Only then this bilingualism, this requires a lot of study from the postgraduates, from all the institutions, and it has definitely have to come to light. So this virtual autism, once they remove their screens are removed, they come back to normalcy. So this is how
this is one good thing. And actually it was during the COVID period that virtual autism came into focus so much. What did we notice? That because of too much of screen time, children were coming with autistic features. Remove the screen, it will improve. Then a lot of other studies were also conducted across the globe, which gave a different insight that this exposure to screens may be one of the precipitating factors for autism. Why are we getting so many autistic cases? These are global studies, where a study from Japan showed that 1-year-old children who are exposed to too much of screen develop features of autism at 3 years. So it's not an immediate effect, it's a precipitating factor. And the good news here is that if you remove the screen, then the children tend to improve. All of us who work with autism have seen this happen. Let us make use of this. With this, we do come to an end, and I will stop here with the take-home message that we would like to all promote, that excessive screen time and poor content viewing is harmful. It affects sleep, learning, behavior, emotions, and health in all children. It can lead to ASD-like features in small children. It can lead to addiction, particularly in adolescents. Screen addiction in adolescence is a definite health hazard. And what we need to do is set limits. We need to encourage other activities, model good behavior, use positive reinforcement, what Dr. Chenthil was repeatedly saying, and be consistent in whatever. As parents, as teachers, as pediatricians, we need to be consistent in what we are promoting. Thank you.
Thank you, esteemed faculty and
So
panelists, for
again,
comprehensive coverage of the need of the hour topic.
Before end, actually,
I end with these pictures. Let us transform from the left to the right. Thank you.
one message to the pediatricians is having listened to this, one point which we have missed is understanding ergonomics. Actually, a pediatrician should talk to the parents, though the screen time has to be avoided, but if the child wants to use the screen time, there is a proper position, how to sit, how to keep his limbs, how to keep his neck, how far the screen should be, at what distance, and the 20-20-20 rule. Please insist to all the parents, they should teach ergonomics to the kids. Thank you.